Have you been able to get back to work?
It took me almost 2 years. Then I was able to do like minor surgeries by 2019. And then since I was doing minor surgeries, that was like a rehabilitation for me, which made me, because you go to the hospital, you stand, you do some minor procedures. So all that develops endurance in yourself. And then I pushed it some more, went for supervision for endoscopy, and I've got permission for endoscopy now. So I do both minor surgery and endoscopy. That keeps my week quite busy. So that's how I'm going. But I still can't run. My next phase is I'm trying to go back to full surgery, at least just to get the license, and then I decide what I want to do.
This is the Recovery After Stroke podcast with Bill Gassiamis, helping you navigate recovery after stroke.
Hello and welcome to the Recovery After Stroke podcast. If you are a stroke survivor with a story to share about your stroke experience, now is the perfect time to join me on the show. The interviews are not scripted. You do not have to plan for them. All you need to do to qualify is be a stroke survivor who wants to share your story in the hope that it will help somebody else who's going through something similar. If you are a researcher who wants to share the findings of a recent study, or you are looking to recruit people into studies, you may also wish to reach out and be a guest on my show. If you have a commercial product that you would like to promote that is related to supporting stroke survivors to recover, there is also a path for you to join me on a sponsored episode of the show. Just go to recoveryafterstroke.com/contact, fill out the form explaining briefly which category you belong to, and I will respond with more details about how we can connect via Zoom. This is episode 278, and my guest today is Dr. Siva Murugappan, who was working as a general surgeon in hospital when nurses on duty noticed that he was showing the signs of an ischemic stroke. Dr. Siva co-authored a book about his experience with his wife Prema, which is titled Frontiers, The Journey of Two Surgeons Through Stroke. Dr. Siva Murugappan, welcome to the podcast.
Thank you.
Tell me a little bit about your story.
Well, I was a general surgeon here in Ontario. I've been working in Canada since 2006. And in 2017, I was actually treating a patient on the ward when I developed a stroke. It was around 4 p.m. in the evening. The nurse identified that I was having a stroke, and they took me to the ER straight away. And I had my anticoagulant given to me very fast within 20 minutes. And then I was in ICU. And then I was transferred to rehab, where the whole program of rehabilitation started. The first few days in ICU, everything was like a blur because you just had the stroke and there's, I think, brain cell swelling and things like that. But then the rehabilitation, I was there in the hospital for 3 months. Slow and steady progress. But the best one was when I was able to walk with the help of a walker and the physiotherapist that takes the cake. Because once you have had this and you're paralyzed, you can't move and they're thinking what's going, you don't realize it until it hits you. And that was the highlight of my whole rehab stay there.
Yeah. So how old were you?
When I had my stroke, I was 57.
What does a general surgeon do every day? So I understand you do surgeries, but what does a general surgeon practice? What kind of surgeries?
So usually anything inside the abdomen is usually general surgery. So our day typically starts, say, about 7 o'clock in the morning. You go and round the wards, you see your patients, make the decisions for the day, and then you go off to either to the OR, that is surgery, or you go to endoscopy, or you go to minor surgery, or you go to the office to see new patients. So that will be the typical flow in a week.
Your process to become a general surgeon, when did you start your studies and how old were you when you finished?
I became a general surgeon in 1993. I was in Malaysia when that happened, and I was 33 years old.
And when did you start your studies? How old were you when you started your studies?
1990 was when I started being in the surgical program. You mean my undergraduate or just
Yeah, the
becoming?
very beginning, your decision to
Oh, the
go
very
to university and become a medicine.
1980.
1980. Okay.
1980.
The reason I ask is because I'm just trying to get an understanding of the span of time that it takes for somebody to become a medicine student and then eventually get to the stage of being a surgeon. So it's your entire life almost, because up until your first few years of life, you're in preparatory school, and then small school for children under the age of 12, and then you go to high school or something along those lines, and then you're spending the majority of your adult life in training to be a surgeon. Well,
Yep.
you might not know it at the time that you're going to be a surgeon, but by the time you get there, you've practiced most of your adult life to be a surgeon, and then you have a stroke, and that
And then you
takes,
lose everything.
and then you lose everything, right? So that's the thing. And you're a medical person. So as a medical person, I'm wondering whether or not it took you by surprise that the fact that you now are not the person providing the help, you're the person that's meant to receive the help. How did you come to terms with all of that stuff happening all in the moment?
Oh boy, the thing that came to my mind always, and this can't be happening to me, but once you try to get out of the bed, you can't. Okay, this has happened. Then you come to terms with it. But it took me a while, but not that long. I think about a week.
Oh.
Come to terms, okay, now I got to see what I got to do, rather than keep on thinking why this has happened.
Mm-hmm. And you were in the hospital when it happened as well. You were in the best
I was
place.
in the hospital. That was the luckiest thing for me.
Hmm. Did you have any idea that something was wrong? Did you get some sort of a sign? Did you, in hindsight, notice that you were potentially in danger?
No, nothing at all. Just like that.
Yeah. And then, is there an underlying cause to this particular ischemic stroke? Were you able to determine what caused it?
No, we didn't. We were not able to find out the exact cause of it.
Mm-hmm. How does that feel, being a doctor and not being able to find the cause of a condition that you have? Is that challenging?
Well, it was left to the other doctors. So I was on the receiving end. So,
It's their problem.
yeah.
All right, fair enough. Fair enough. So you're in the hospital, you've gone through the whole process to discover that you've had a stroke, and they've been able to remove the stroke with with TPA. Was it TPA that was given?
Yeah, it was TPA. That thing just dissolves the blood clot.
The clot, yep.
Yeah.
And Did you notice a difference? Did you feel a difference after that blood clot is gone? What is that feeling like? Do you come back online? What's that like?
It's like I can explain to you exactly what I felt. The TPA was going in. While the thing was going into the body, I was able to move my left side. And
Uh-huh.
I was actually showing the nurse, look here, everything is moving very well. And then say 2 hours later, nothing moved.
Mm-hmm.
That's when the swelling of the brain cells takes place, and that makes it even worse, I think.
Uh-huh.
That was how.
And then the swelling eventually, does it subside? What happens to the swelling after that?
Well, the premise is it will subside. It might take about 1 to 2 weeks, but lasting effects like constantly inflammation of that area can be keep on going, which can extend the paralysis.
Mm-hmm.
So to your question about how was I behaving as a doctor, being a patient, I kept on reminding myself, you are a patient now, Siva. You don't question anybody. You just take it. Even if it is utter ridiculousness, you just accept it. I kept on reminding myself about that. Because you know why? The slightest thing the nurse will think, okay, doctor is trying to, show his strength or something like that.
Ego.
So you got to be more extra careful so that you don't cross boundaries while receiving treatment.
Because you're
But
not
I
a
should say
doctor
they're
anymore.
extremely nice to me, but it is just me.
You're not a doctor at that moment. You're a patient.
Moment,
Yeah. And you are receiving the care, so you have to allow people to make
yeah,
the
do their work.
judgments
Yeah.
and do their work. Yeah. Uh-huh. That must be surreal. That must be a surreal situation to find yourself in.
Oh, yeah.
Mm.
Used to just giving orders and walking off. And then now you are here, okay. Even if you can see that they can't do it properly, you just have to close one eye.
Yeah. So it's been a few years now.
It's been
Have
6 years now.
Have you been able to get back to work? What was the situation like for you to transition back to, we'll call it regular life?
It took me almost 2 years. Then I was able to do like minor surgeries by 2019. And then since I was doing minor surgeries, that was like a rehabilitation for me,
Uh-huh.
which made me, because you go to the hospital, you stand, you do some minor procedures. So all that develops endurance in yourself.
Mm-hmm.
And then I pushed it some more, went for supervision for endoscopy. And I've got permission for endoscopy now. So I do both minor surgery and endoscopy. That keeps my week quite busy. So that's how I'm going. But I still can't run. My next phase is I'm trying to go back to full surgery, at least just to get the license, and then I decide what I want to do.
If you've had a stroke and you're in recovery, you'll know what a scary and confusing time it can be. You're likely to have a lot of questions going through your mind. Like, how long will it take to recover? Will I actually recover? What things should I avoid in case I make matters worse? Doctors will explain things, but obviously you've never had a stroke before. You probably don't know what questions to ask. If this is you, you may be missing out on doing things that could help speed up your recovery. If you're finding yourself in that situation, stop worrying and head to recoveryafterstroke.com, where you can download a guide that will help you. It's called 7 Questions to Ask Your Doctor About Your Stroke. These 7 questions are the ones Bill wished he'd asked when he was recovering from a stroke. They'll not only help you better understand your condition, they'll help you take a more active role in your recovery. Head to the website now, recoveryafterstroke.com, and download the guide. It's free.
So you have to prove yourself again. Is there some kind of a cognitive test as well as a physical test that you have to do to prove yourself being capable to deliver procedures?
I don't think they want any cognitive test. They just want to see, okay, you are in the situation, sorry, I just got disturbed there.
That's okay.
We just have to prove that if I am the leading surgeon there, will I be able to do it? And I have to do it on a live patient, and there will be an assessor, another surgeon who will assess, okay, is he able to do things?
Okay.
And they might throw in something, see how I manage a complication,
Yeah. When you're in surgery and you're the main surgeon, how many other surgeons are supporting you?
Usually one assistant. Just one. One assistant, one nurse.
And the assistant is as capable, for example, as you are, so that if you need to step away or move along.
No, the assistant is not as capable as the surgeon.
Okay. What's the assistant's role then?
The assistant's role is surgery is all about exposure of the particular body part.
Mm-hmm.
So it usually means retraction of the abdomen so that we can have a proper view and do the things we need to do. Then cutting sutures. Retraction and cutting sutures are the main things of an assistant.
Okay. So they're assisting you with the procedures that you're performing so that they're performed more quickly?
Yes, it can translate into time saved. If not, just imagine I put a suture in, then I have to cut the suture. So every time it's like excessive extra movements, which is not necessary if the assistant is there.
It's not as efficient.
Yeah. Efficiency improves. And I think also for a surgeon, no matter what happens in your mind space, you still got to keep your calm and cool. So if you're doing everything yourself, you get agitated fast.
Okay. So it's about having some tasks delegated to somebody else so that you can focus on the task at hand.
Yeah. Like the task, the nurse will be to get all the instruments in correct order so that we can just pick it up.
Okay. So when you're being assessed, is that an ego problem there? Is somebody watching you while you're doing surgery? Do you have challenges with the fact that somebody's assessing you, or because you went through this process of being comfortable as being the patient and then now wanting to get your wings back, so to speak, is it good to have somebody assessing you and making sure that you're okay? What's the thought process around that?
My thought process, Bill, is anybody under the microscope, you won't do well.
Yeah.
What do you think?
That's kind of my thought, but I wouldn't know what happens when you're when you're a surgeon.
Yeah, but when you're a surgeon, they'll put you through that. There's no two ways about it.
I understand why they would do that. I'm perfectly happy that they did that to you. But like you said, somebody watching you while you're working to assess you on a live patient can be a little nerve-wracking. But I imagine surgeons are generally cool, calm, and collected because you have to do work that's life-saving, life-threatening, whatever. So you can manage that type of scrutiny.
I think so. I know so.
Yeah.
I'm going to go for it soon. Yeah.
Yeah. So how did you've decided to write a book about the journey?
Yes.
Can you give me a little bit of an insight as to where that idea came from? Why
Well,
was it necessary to write a book? Let's talk
I
about the
want
book for a moment. Let me talk about the book for a moment by just actually stating the title of the book, Frontiers, The Journey of Two Surgeons Through Stroke. So there's somebody else involved in this story, not just you.
yeah. It's me and my wife, who was the primary caregiver. So it's my perspective and her perspective also. Because she is also another surgeon. So she has to continue doing surgery as well as take care of me. So her perspective is actually hers was a bigger burden than mine. And the reason to write the book was actually my wife's. She kept telling me, Siva, you need to tell your story to the world. You need to tell your story.
Yeah.
That's how this came about. And she went to the rehab place. She was trying to find some books on stroke written by patients. We don't want to read all these medical books because we have read them anyway. And she couldn't find any. And then our situation was unique in the sense the surgeon getting a stroke and trying to come back. It would have been an easier pathway if the stroke had made me permanently paralyzed. Decision made, right?
Really?
Yeah, if I'm permanently paralyzed, then decision is made for you.
Okay.
Yeah, you are not going to struggle through a paralyzed limb. But once you start recovering and you know you can recover, then you have to.
When decision is made for people who have had a paralysis, be it on their leg or their arm or their left side or their right side, it's still a struggle, is it not, to overcome other things?
No, it is a struggle for daily life,
Yeah.
daily, what do you call the daily activities.
Yeah.
That is itself is a struggle. Why would you want to go back to surgery?
Right.
Yeah. So that's how I looked at it. But this one I recovered, so I said I'm going back. So the
Yeah.
struggle of going back is also there.
Is part of the story. The cover has a picture of Sisyphus.
Yep.
And Sisyphus, for people who don't know, is it's an ancient Greek mythological story of a man holding a boulder and trying to push it up a hill.
Yeah.
And the story goes that every evening, when he finally gets the boulder to the top of the hill, and he wakes up in the morning, the boulder is at the bottom of the hill, and he has to do it again. And he's been punished by Zeus. Zeus has given him this task because Sisyphus was, I think he was a little bit cheeky, did the wrong things, something like that. And that's his lifelong punishment. Give me an insight into why the cover has a picture of Sisyphus on it.
Bill, it's a daily struggle, man. It's a daily struggle. So you got to be like conscious of everything that you were unconscious of before.
Mm-hmm.
You have to be.
What are some of those things that you have to be conscious of that you previously could take for granted?
Like a simple thing like getting into your car. You go, I open the door with my left hand, and then I hold the steering wheel, And then I feel that, okay, I've got a good grip, and then I get into the car. I don't think anybody just thinks about all those things.
No,
Yeah.
I know
We just,
exactly. I know exactly what you mean. So when I wake up in the middle of the night to go to the bathroom, I have to physically ensure that my feet are on the ground of my bed. Because
yeah,
if I don't, what happens is I can lose my balance in the middle of the night because my left leg is still, it's sleepier than my right leg, and it takes a little bit of time to warm up and to wake up.
yeah.
And if I'm not paying attention when I'm half asleep and I don't notice that my leg is not on board, I could fall over in the middle of the night.
Oh,
So that happens every single day, whether I wake up in the middle of the night or whether I wake up in the morning. I have to ensure that my left leg is up for the task.
yeah, I can imagine that too. Yeah. Consciously making sure, yeah, my legs are on the ground now so I can move.
Yeah. So with your daily struggle, this daily struggle, does it add a level of difficulty on some days where it makes some of your days harder, or is it just part of life now that 6 years have elapsed?
I'm beginning to be working and moving at a spinal level now. I don't think as much as I used to do 2 years ago. That much I can say. I think time slowly heals. And that is a great hope we can hope for.
And do you also feel like you're adjusting personally? You're finding ways to adjust and do things differently, and now that's starting to become subconscious?
That's exactly what I mean. Yeah, subconscious.
Mm-hmm. What were the hard parts for your wife to have to deal with? What did she have to deal with, as well as going to work and then come home to be your caregiver?
I'm always lamenting to her. So she's got to be a counselor at home and a surgeon in the hospital.
That's a profound statement.
So that's been a lot on her plate.
Mm. Is it is the are the things that you need to talk about regularly with your wife, are they stroke things? What are they? Are they identity issues? Are they, what kind of things challenge you that you need to talk about regularly?
Well, things like basically organizing the day. Okay, from this time to this time, you're going to do this, and then after that, the next good. I do the grocery shopping nowadays. I just want to be out, so that's a constant rehab, and I hope in coming years, all that will become like a subconscious level.
Uh-huh.
I was never a good organizer. I never plan first thing in the morning for the day, and now I do it.
And is that because you have to get through your day, to make it through the day? Or is it something else that's happening there?
It's not, I think initially when it started off, it had to be like that. And so I'm just carrying it on.
Is it helpful?
Not really. To tell you a fact, not really.
Is that because you're putting a lot of time and energy into planning how your day is going to unfold rather than just letting it unfold?
I think so. I think my personality was such that I never used to put too much emphasis and planning and energy on to plan for the day. I just let it unfold and I tackle it as I go.
Mm-hmm. How many hours of surgery how many hours are you working these days? And has that changed from the hours that you did before the stroke?
Oh, yeah. Now I work about 40 hours a week. I used to work about 80, 90 hours a week. And that's inclusive the days you're on call and all that. Now 40 hours is, now the work week is like you go, you do one particular work part of the place and you come back home. Those days it used to be all over the place.
In multiple locations, and then you do your rounds and then you check up on your patients. Are you still
Yeah,
doing all of that, or and is there less surgeries involved in your day? Why did the hours decrease from 80 to 40?
because my type of surgeries are minor surgeries, which can be done under local freezing
Uh-huh.
in the area and do the surgery. So after the surgery, the patient walks back home. So I don't have to look after him after that. Then he comes back, he or she comes back it's all outpatient. So that has reduced my inpatient care.
Okay. So they're day procedures, people come in, they have a procedure, they go home, and then they might see you in clinic a few weeks later for a checkup.
Exactly.
Uh-huh. And you have clinic days and then you have surgery days.
Exactly.
Okay. Is that better that you're doing 40 hours a week? Personally, does it feel okay? Because I have a sense that surgeons, doctors thrive on, well, it may be tiring and difficult to do 60 or 80 hours a week, but they thrive on their job and on helping people and on being there for them and on seeing their patients. Feel like it's part of the territory. And when it's taken away and it's decreased to half, does that mean that that's not a good thing, or has it, in your case, has it been good that you have less work to do?
I think in my case, it's a good thing for going forward.
Uh-huh.
It is all about how much of stress you're putting on your body and mind.
Mm-hmm.
And now after the stroke, I realized that. So it takes a stroke for me to realize that. Those days we don't realize it because we are so engrossed in it.
Right. One of the weird things is that I was involved many years ago in a little uh, television promotional news story that was done for the Stroke Foundation, where they were talking about the amount of hours that people work puts them at greater risk of stroke. And of course, anything above 40 hours a week, the statistics towards the risk of stroke increase almost exponentially. And then by the time you get to 80 hours a week, it's a pretty terrible statistic. You know, many people are going to be unwell. They may not have a stroke, or they may have another medical condition. Doctors' jobs are to keep people out of hospital. Yet you guys seem to be doing the kind of work and the amount of hours that increases the risk of uh, medical emergencies for yourselves. Have you ever contemplated that before? Have you ever taken notice of the fact that you guys do almost the exact opposite to what is recommended for the general population?
It's really funny you asked me that question. That has never occurred to me. I think our training is such that you're just following in the track and you don't stand back and step back and think, okay, what is going to happen to my body, my mind, if I keep on working like this? But your training was such that if you keep on training like this for many hours, you get good at it. And then you don't feel it. So that's a positive way of looking at working for long hours. And your body is used to it and you're questioning yourself. Even if somebody asks you, don't you feel tired? Not really. End of the day, you say, I can still go for another surgery. So it used to be like that. And then you also didn't want to be seen like, you can't endure this journey. That's the other part of it. To your superiors and your peers,
Mm-hmm.
you cannot be seen that you cannot endure this. It's not a struggle, this life.
This way of life.
Yeah.
See, if we put factory workers or production line workers on an 80-hour week,
Okay.
the streets would be filled with labor unions complaining about working conditions.
Oh, definitely. But there, the workers, if you have put them through a training period of 5 years of 80 hours and more a week, later on they won't be complaining. There won't be much of a, this union thing and all that. I think it is all got to do with that formation period, the training period.
And how intense it is.
Yeah.
It just staggers me. Do you see many of your colleagues come and go as a result of the large amount of time and effort that needs to be put into a job like being a doctor or a surgeon? Is it a high rate of loss of people from the industry or from the occupation?
No, I don't see that. So if we happen to see that, and if it was significant, by the time we all decide to become surgeons, that would be a big thing coming up. The question, why would you want to do this? Here, all the while, people are just encouraging you all the way. Everybody.
So it's a culture.
It's a culture, yeah. So maybe I should start discouraging, eh?
I don't know what you should do. Don't take any advice from me. But I'm just worried about all those amazing doctors and nurses who struggle being at work away from their families for 60 hours a week or 70 hours a week or 80 hours a week. I thoroughly appreciate it. Don't get me wrong. I benefited from that system. But when I'm doing this type of work, the work that I'm doing now, and I'm interviewing people and understanding how stroke occurs, many of the people who I've interviewed will tell me they're overworked and there's not enough downtime and there's not enough time for themselves, and there was not enough time for them to go to the doctor or see a doctor or get blood tests or whatever, or take the headache seriously. And it's just, to me, it seems like there's a whole industry of people inside these four walls. They may as well be a factory inside a hospital, and they are working double the amount of time that the majority of the people in the population are working. And somehow it's just part of the job. It's everything that you're meant to do, and don't worry about it.
Yeah.
Did you have time for yourself during this 80-hour work week? Do you have time to decompress or to run or to be fit? Or
I had, Bill. I golf.
Uh-huh.
I make sure the weekends which I'm not on call, I golf.
Okay.
So that takes away my mind completely from the hospital. I don't think about the hospital or patients
Yeah.
at that time.
Yeah. Okay.
So you are with your friends, you're golfing. That's a good de-stressor and downtime for you. And then, of course, with family, you go back home and then you go for dinners or you cook with your family. That's the other downtime.
Yep. Are you any good at golf?
That's a good question. Who is good at golf?
Tiger
Except
Woods.
the
Okay. Okay. So it's not about being good at golf. It's just about being at golf.
Yeah, that's right.
That's awesome. Yeah. I've never played golf. I don't think I ever will. Not when I was capable, physically capable, and I definitely won't now. It's a very good way to ruin a good walk, golf, isn't it?
You say that, but it is actually funny when you start playing with your friends and the ball, the fairway is so huge in front of you,
Yeah.
and somehow you manage to hit that ball into the water by the side. Laughter all the way to the greens.
Yeah.
Yeah,
It's almost impossible to miss the fairway, but you end up in the water.
yeah, and you still manage to miss the fairway.
Yeah. Yeah. I understand. How many holes do you prefer to play? 9 or 18?
18.
Okay.
Yeah.
Were you able to get back to golf quite well after all of the stuff that you went through? Was that also a difficult transition?
It was a difficult transition. Nowadays, I'm able to walk 9 holes and play golf and come back.
Uh-huh.
Yeah, I considered that as an achievement. So I'm slowly getting there.
Yeah, that's good. 18 holes would be a little bit too draining on your energy levels.
It is. Even 9 holes is draining. I try to walk rather than take a cubby.
So you feel like this is all part of your rehabilitation. I love that. Your daily tasks
Yeah,
are part of
daily
your
tasks,
rehabilitation.
everything,
Yeah.
every single thing.
Yeah. I do love that. I ride my bike for the same reason, and I have an electric bike because pedaling with my left leg, it actually suffers far more fatigue than my right leg. So if I went for a 20-minute ride, my right side is good to go for another 20, 30, 40 minutes or an hour. My left side has already said enough, get me home. But with the electric bike, because it assists the pedaling, I can be out for 2 or 3 hours and it doesn't feel like I come back exhausted, even though I have to rest. It allows for a much longer stay outside. And that's the purpose of being on the bike, to be outside and feeling the wind and all that kind of stuff.
Yeah.
So I love the fact that I've been able to get back to riding and it's not painful and difficult. And as a result of that, I get to still enjoy it. And I consider it part of my rehab. And one of the other things I do for my rehab is where there's an escalator
Yeah.
and stairs, you know how sometimes you go to a venue and there'll be stairs going up
Yeah.
2 or 3 flights, but then also be escalators. I always take the stairs if I can, so that I kind of see it as like, while I can take the stairs, I am going to take the stairs. And it's a really difficult climb, 3 flights to the particular spot I want to go. And my leg is tired by the time I'm going up the 3rd flight. But it's kind of like it's a little exercise. It's a little rehabilitation. For example, in a shopping center is a perfect place when you have multi-level shopping malls. And then, and I use that as a little bit of a rehabilitation thing. I've been doing that from the beginning, from when I was able to walk again.
That's great. Yeah. I do the same thing in the hospital. I'll take the stairs.
Yeah.
But the pace is quite slow. But
Mm-hmm.
it's okay. Nobody's around, so you can just.
Yeah. You're not getting in anybody's way.
Yeah.
And the same thing with the shopping malls. Nobody's using the stairs anyway. They're all using the escalator.
Yeah.
So it's pretty good. So tell me about the book. When is it out? Is it ready to launch?
I think it's launched.
Because I do see it on Amazon here.
Yeah, it's published in Amazon, and we have a website called frontierstroke.com. There's a website.
It's available in all bookstores.
And it is available in all bookstores. Other than Amazon, it's on Barnes and Nobles.
Mm-hmm. Okay. You've got a copy of the book there?
I do.
Hold it up so people can have a look. I'll include all the links and everything. And how many pages is it?
100 pages.
Nice.
It's a short read.
And give me a bit of an idea of the theme.
Most of it, I think we have spoken about.
Yeah.
And then all my feelings at that particular time, I put it in detail. So a person who's going through the same story can feel, I think it's just like, you just need company. Okay, the other guy also felt the same thing. So it makes you feel a bit better.
Yeah. Less alone.
Yeah.
How have your colleagues responded to your journey?
My peers, they went about their lives as usual.
Mm-hmm.
And of course, I didn't expect anything else. They were busy trying to get another surgeon so that they don't have to do many calls.
Mm-hmm.
I mean, that's all expected. But on a physical level, I mean, they felt sorry for me.
Yeah.
Probably they were thinking shouldn't work too hard. Maybe. But it was shocking because I worked in a small community. So all the doctors were quite shocked. I haven't done talk to many of them to see how much they have reduced their working hours after this has happened to me.
Probably none.
Yeah.
Yeah.
It is already ingrained in every cell of the body.
Yeah.
So they can't reduce it. It's just going to be there.
It's part of the identity.
Yeah.
Tell me about what the hardest part of stroke was for you.
It was mental.
Ah.
Yeah. It is like you're sitting down there and thinking and thinking and thinking, and you're trying to tell yourself, don't think, just be. That never happens. With the brain and all the brain waves going on, of course, you're going to be thinking. And it's always thinking, okay, will I be able to do this? Will I be? I mean, my career as such, one, I was thinking about it, but then, you want to move, you want to be independent.
Mm.
So all your thought process is going into that. I didn't find my physicality to be a real problem, but the mental ability to understand, okay, your life has changed. You got to adapt. That was a big hurdle.
Yeah.
You should ask me that because when I was in the rehab, the therapist, one of the therapists, she came. I wanted to talk to you about today. The topic is life after stroke. So I just looked at her and I said, what do you mean life after stroke? I'm going back to work. So then I realized they were thinking in their mind, I won't be going back. So they wanted to teach me something else to do with my life, you know.
Yeah. How much
Yeah, I
harder?
do.
How much harder would it have been if you didn't get back to work?
Oh, it would have been very hard, Bill. My personality, I would have been crying every day inside. It's not like I'm really totally or even more than 50% disabled. I can still move and do a lot of things.
Mm.
So that sort of pushes me further. No, I can go all the way, you know.
Yeah. Take what you've got and you'll use it to the best
Man,
of your ability, to the max, to the greatest extent if you can. Yeah.
right. Yeah.
Well, I understand that. So what's something that stroke has taught you that was unexpected that you didn't realize?
The biggest thing I think I learned from it is patience. Patience, especially in stroke. Don't think that by doing a lot of exercises and doing them more often, you're going to get better quickly. Stroke takes its own time. And the time, we are not talking in terms of days, weeks, or months, it's years. It's going to take years. Nobody tells you that. But then this happens. And you got to be very patient. And also, I would say, stop planning. Take every day at a time. People come and say one step at a time. I never used to really bother about that statement. I do realize now you have to be controlled in that one step at a time. You can't expect to achieve a lot of things by putting in more work. It doesn't happen that way. Your legs become more spastic rather than do anything good for you.
Yeah. I
I
learned
think
that
patience.
I learned that lesson as well, that time, that everything takes time. I've been going through this since 2012 for 11 years. My brain surgery was in 2014. So it's been 9 years since my brain surgery. And it's the longest time I've had to focus on a task in my life. And that task is rehabilitation. That task is being better, feeling better, being more active. And let me tell you, there's ups and there's downs, and there's things that get in the way all the time. And what might be minor for another person who hasn't had a stroke is a major setback for me. It takes ages, you know.
Yeah.
So time, it's just, everything does take time, and it's such a simple thing to say, but it's a different thing to deeply understand what that means and to be okay with the fact that it's been 9 years and my recovery is still ongoing.
Always recover, I think.
Yeah. Do you think it's made you a better surgeon, better doctor?
I think so. In terms of, I give my patients a better year now. I listen to everything they say. Those days they come and tell me a few things. I've already made my decision. Okay, this is probably what it is. Now I don't focus on what I would like to diagnose. I just listen to them. it's like story time, You just sit down there, you listen to them. Maybe you want to add or subtract something with them, and it's going well. I think I have understood the essence of one step at a time.
Mm-hmm.
Try not to get too many things within a short period of span of time.
Yeah. Which means that you're more likely to achieve something, because if you don't have a deadline or a timeline on a task or an outcome, you won't get disappointed that you didn't make it there in 12 months or 13 months. You're always thinking about getting to the destination, but it's not about the destination. It's about the journey. It's about continuing the journey wherever the destination is and however long it takes to get there. What would you like to tell other people who have just had a stroke? Maybe they're listening to this podcast. It's the first one they came across, and, they're hoping for some guidance and support. What would you like to tell a recently diagnosed stroke survivor?
There is light at the end of the tunnel. You just have to be a bit patient and keep moving.
Thank you so much for joining me on the podcast and reaching out to be on. I really appreciate you sharing your story, and I look forward to hearing about how your book does. Thanks for joining us on today's episode. Remember to grab a copy of Chapter 1 of the book, The Unexpected Way That a Stroke Became the Best Thing That Happened. Just visit recoveryafterstroke.com/book. Take a look around and discover what the book is all about, and click the download free chapter button. As always, to learn more about my guests, including links to their social media and other pages, and to download a full transcript of the entire interview, please go to recoveryafterstroke.com/episodes. Thank you to all those people who have already left a review. It really does mean the world to me, and it makes a massive difference in helping others that need this type of content, and it helps them to find it easier and make their stroke recovery just that little bit better. If you haven't left a review and would like to, the best way to do it is leave a 5-star review and a few words about what the show means to you on iTunes and Spotify. If you're watching on YouTube, comment below the video. I love answering people's questions or interacting with them after they watch the video. Like the episode, and to get notifications of future episodes, subscribe to the show on the platform of your choice. Thanks again for being here and listening. I truly appreciate you. See you on the next episode.
Importantly, we present many podcasts designed to give you an insight and understanding into the experiences of other individuals. Opinions and treatment protocols discussed during any podcast are the individual's own experience, and we do not necessarily share the same opinion, nor do we recommend any treatment protocol discussed. All content on this website and any linked blog, podcast, or video material controlled this website or content is created and produced for informational purposes only and is largely based on the personal experience of Bill Gassiamis. The content is intended to complement your medical treatment and support healing. It is not intended to be a substitute for professional medical advice and should not be relied on as health advice. The information is general and may not be suitable for your personal injuries, circumstances, or health objectives. Do not use our content as a standalone resource to diagnose, treat, cure, or prevent any disease for therapeutic purposes or as a substitute for the advice of a health professional. Never delay seeking advice or disregard the advice of a medical professional, your doctor, or your rehabilitation program based on our content. If you have any questions or concerns about your health or medical condition, please seek guidance from a doctor or other medical professional. If you are experiencing a health emergency or think you might be, call 000 if in Australia, or your local emergency number immediately for emergency assistance, or go to the nearest hospital emergency department. Medical information changes constantly. While we aim to provide current, quality information in our content, we do not provide any guarantees and assume no legal liability or responsibility for the accuracy, currency, or completeness of the content. If you choose to rely on any information within our content, you do so solely at your own risk. We are careful with links we provide. However, third-party links from our website are followed at your own risk, and we are not responsible for any information you find there.